Today on Forbes, this CEO's $1.7 billion health startup began with moms. Now she wants to expand to all women. Before she became a mom, Marta Bralic Kerns had worked in healthcare as both an executive and a consultant, trying to use data to improve care. But even though she was deeply familiar with the industry's problems, giving birth to her daughter was still a shocking experience. She had access to great doctors and health insurance, but maternal care seemed haphazard. Nothing was personalized. Her doctors didn't reference much maternal health data to inform her care. She struggled to find good advice about how she could have the healthiest baby possible. She told Forbes, quote, "That was such a stark disconnect to everything I was working in healthcare." So Bralic Kerns started asking questions of OBGYNs and fetal care specialists. She learned that 1 in 10 babies will be admitted to a neonatal care unit, far higher than she'd expected. Many of those admissions were for risk factors like preeclampsia, a complication that causes persistent high blood pressure that could have been identified and treated earlier in the pregnancy. With her experience as a consultant on Arkansas's Medicaid benefits for maternal care, and as an early executive at Flatiron Health, which used data to improve cancer care, she decided that she could do better. In 2021, she founded Pomelo Care to solve one of the most difficult problems in U.S. healthcare: how to improve maternal and infant care to patients covered by Medicaid, a notoriously difficult population to treat because of chronic conditions, lack of consistent medical care, and often life instabilities. Pomelo now also works with commercial insurance. Today, the startup covers 25 million lives and claims to support nearly 7% of all U.S. births. It works with major insurers that include United Healthcare and Elevance, as well as big employer plans such as Coke Inc. New York-based Pomelo, which is named for the large citrus with the hard protective rind, delivers 24/7 virtual care, using data to flag patients' pregnancy risks and monitor them continuously for issues. For example, a low dose of aspirin can prevent the risk of preeclampsia by 25%, an inexpensive solution to what can become a costly and traumatic NICU stay, but requires identifying the patients at risk early. The care is entirely covered by insurance and free for patients. Insurers are willing to cover Pomelo because of the potential to reduce costs. NICU stays are particularly costly, adding up to more than $25 billion a year. Pomelo's program reduced its Medicaid patients' costs of care by a total of 15%, with a 46% reduction in ER visits and a 58% drop in NICU admissions, according to data it presented last year at the Society for Maternal Fetal Medicine and International Society for Pharmacoeconomics and Outcomes Research. Bralic Kerns, who is 35 years old, said, quote, "We built a care model to identify who is at risk for pregnancy complications and then deliver the best evidence-based care we know." Bralic Kerns recently told Forbes that the company had raised $92 million, led by venture firm Stripes, at a valuation of $1.7 billion. That represents a more than threefold increase over its previous valuation of $500 million in June 2024, according to VC database PitchBook. Andreessen Horowitz, Box Group, and others also participated in the funding. With the new funds, Bralic Kerns plans to expand her virtual care model to women at all stages of their lives, including postmenopausal women and children. Ron Shah, a partner at Stripes who led the round, said, quote, "She is a very disciplined operator." Shah has been tracking Bralic Kerns since her days at Flatiron, where Stripes was also an investor. He said the company consistently surpasses its targets on metrics that include operating expenses and burn rate. The new valuation, he said, quote, "is a big jump, but if you look at the operating results of the company, it is much bigger, generating much more revenue, with much more traction and much more visibility around what 2026 and 2027 would look like." Pomelo declined to disclose its annual revenue, but charges based on a per-person, per-month fee. For full coverage, check out Amy Feldman's piece on Forbes.com. This is Kieran Meadows from Forbes. Thanks for tuning in.